Hello. Today in this video, I'm gonna talk about lactase intolerance. Lactase is the major form of carbohydrate in milk. It is a disaccharide made up of the union of one glucose and one galactase molecule. Lactase is absorbed into the body by the small intestine. In order to absorb, it has to be digested back into glucose and galactase. Lactase is an intestinal brush border enzyme which catalyzes the conversion of lactase into glucose and galactase. Deficiency of lactase causes inability to digest lactase, which is known as lactose intolerance. There are 3 types of this disease, depending on the underlying cause. Primary lactose intolerance occurs mainly due to aging. Usually begins after childhood. Lactase secretion reduces as the age increases. Secondary lactose intolerance occurs due to an illness which causes damage to the intestinal brush border. Lactase secretion reduces, and sometimes there may be no secretion at all. Some common examples for these illnesses are diabetic gastropathy, carcinoid syndrome, gastrinoma, and kwashiorkor. Congenital lactose intolerance is a rare autosomal recessive disorder in which the child is unable to secrete lactase from the birth. Now let's see some common signs and symptoms. Deficiency of lactase enzyme causes accumulation of lactase in the small intestine. As we know, lactase is an osmotically active compound which can drag fluid and electrolytes towards it. So as a result, fluid and electrolytes accumulate inside the small intestine, resulting in swelling of the intestine. Too much of stuff in the intestine impairs the absorption of other nutrients as well. Due to the high fluid content, diarrhea is frequently associated with lactose intolerance. Dehydration occurs due to the fluid loss. Free lactase is fermented by the colonic bacteria into short-chain fatty acids and hydrogen gas. Hydrogen gas causes bloating and fluttering inside the gut. Abdominal pain, nausea and vomiting are some other symptoms. Now let's talk about the treatment. Lactose intolerance is a common disorder and it is not life-threatening. Dietary management is the primary form of treatment for lactose intolerance. Patient is advised to reduce or restrict lactase-containing food, such as milk. However, fermented milk products such as cheese and yogurt are well tolerated because they contain lactic acid and not lactase. Recently, commercially available lactase enzymes are also used to reduce symptoms. And for the secondary lactose intolerance, you have to treat the underlying cause.